Always great to see you here, and you're becoming a little bit of a familiar face on our HITLAB events, which is excellent. But for those who maybe don't know you, can you start by just giving a brief introduction and talk a little bit about your background?
Sure. Great to be here, Riley. Always a pleasure to be with you and the HitLab team. So my formal title is Director of Corporate Compliance at Emblem Health, but I also sit on our DEI Council, and I'm a founding member and leader of our LGBTQ Employee Resource Group. So it's sort of an interesting sort of marriage, if you will, of the two items. So compliance helps to inform some of the work that we're doing across through the lens of DEI, and we're really working to show how not just the product that we offer, but just how we can impact our communities, the LGBTQ communities, make sure that we're doing all that we can to improve visibility, to ensure that all those folks are getting the healthcare and wellness benefits, and then just sort of be an advocate for the community at large. And that's why I'm grateful for working with you and HitLab. Gives me an opportunity to share some of the good news and some of the challenges across the larger LGBTQ space. I'm not particularly an expert specifically in that health. I'm not a provider, but I'm great to sort of help share the news and the message to your broader audience and help people to understand what they can do, what's being done, and to hopefully help others to increase visibility and health equity.
Yes, excellent. And let's unpack that a little bit. So,
Sure.
what are some of the key challenges that LGBTQ plus individuals face in accessing healthcare, and how can technology help mitigate some of these issues?
Sure. So I think, I mean, like a lot of things, it's certainly within the US, it just sort of depends on where members and patients live. Some areas and pockets are really doing a great job of meeting the needs, and other areas not so much. So I think traditionally, and even still now, discrimination, lack of understanding, and cultural competency is still a big issue. And there was a recent survey that sort of profiled and asked LGBTQ patients, what's your greatest challenge? And the simple answer was being able to select and find either an LGBTQ identified or sort of aligned provider. And so there are some tools that allow people to do that. GLMA, which is a health professionals association, they have an online database where you can type in your zip code and it will give you a list of providers in your area that are identified as LGBTQ. There's another organization called Violet that's partnering with GLMA to provide online cultural competency training, and providers can get CE and CME credits for that. So those are some simple things. And then just accessing the vast resources available online for webinars, for resources, for toolkits, for tips. It starts with providers and basically all medical center, hospital staff taking the initiative to say, how can I better inform myself about my LGBTQ patients? The same simple as marketing and communications. One of the I know a lot of the hospitals here in New York, Mount Sinai, a lot of their waiting rooms have signs that says LGBTQ Patients Bill of Rights. Something as simple as that. Having photos in the waiting room that don't just show hetero couples, but same-sex couples and their kids. Intersectionality. Those are very simple tools that can go a long way to helping LGBTQ patients feel comfortable, feeling welcomed, and that they're being heard, and that their provider and even the medical center staff is listening to them, understands their preferred pronouns, etc. It's a vast sort of continuum, but it starts very simple.
Yeah, those are some excellent, easy steps to take that can, improve just the way that, everybody is received when they're looking for the healthcare that they deserve to get. And let's talk a little bit more about, digital health platforms and how they're tailoring to meet specific needs of LGBTQ plus populations, particularly focusing on mental health and for youth and for underserved populations. Can you unpack that a little bit more as well?
Yes, again, sort of nothing terribly complicated or that you need advanced degrees to understand. But I would say one of the most simplest tools is to access patient portals, ensuring that our patient portals are designed to allow patients within the confines of privacy of their own homes to go in and to update their profile, include what are their preferred names and pronouns. I know in Epic, for instance, and other EMRs, people can put everything from preferred names, they can put a history of their gender affirmation surgeries. There's a section where they can actually list sort of anatomy and body parts. So all that can be done so that when they meet with the provider, they can look at it, and just as they see other things, their demographics, their vital signs, medical history, they can see those things. Have they successfully transition? Where are in that process? So I think patient portal is a huge thing. I would say accessing the resources that I've already talked about. And then there's a grassroots organization based out of Hartford called the Health Collective. And they're doing things such as updating their databases, their CMR systems that can capture things such as key identifiers that might come off of a patient portal or EMR. They can also include information about patient scheduling. Patients can go in and schedule it. And then on the other end, they can pull appropriate data, obviously following privacy and HIPAA rules, to pull information for board reporting, for grants and fundraising, demographic aggregate information. So having those robust centralized systems that can pull all that information together. It can be things as simple as ensuring your websites are updated and allow people to easily access and register for events, and they can capture key information. What's your name, your preferred name, your pronouns, how do you identify, are you registering for this event? One of the things that the Health Collective does is they really focus on youth, so they can allow their constituents to register for things such as their healthcare coalition conferences for youth, and ensuring that they're not being more invasive, and that youth feel like they can register what they need to do, that they're not asking for unnecessary information, that they're not going to be sending a report to their parents and say, oh, do you know that your son or daughter, your child has signed up for this LGBTQ event? It's ensuring that there are safeguards in place that allow our already existing systems to be updated to capture information that helps. And then another thing that the Health Collective is doing is they're providing their mobile crisis response teams with updated laptops as they go out into the field and are intervening and meeting with folks. That can ensure that they've got the tools that they need to meet people where they are. They can refer them to other providers, to social services. They can do it right there with the patient, with the member, and sign them up for whatever programs are necessary and needed.
Yeah, it's amazing, and it sounds like you're a great advocate for them. So I'm gonna put you on the spot here a little bit and have you advocate for HITLAB. So you spoke at our summit in May. You gave a great speech. So for someone who might be on the fence, why should they come to the one that's going to be in December in person in New York City at the Microsoft Tech Center?
Great question. I think because of the personal connections, this was really, I haven't had a chance to share this with you, Riley, but right after my talk at Microsoft Center, I had a woman come up to me. She said, I was looking at I was looking at the agenda, and she said, I saw that you were listed and, as speaking on this topic, and as a lesbian woman of color, I never get to hear or see these topics. So she goes, it was very clear to me that I needed to make sure I would get to your session. So I think for those folks who don't necessarily get to see these topics in some of the spaces, some of the conferences, some of the webinars, I would say yes. And whether I'm there or someone else or additional folks, I think that's important. And then I think just, as you and I have talked about, Riley, this is an important space, and it gelled with all the great things you're doing. The person that spoke to person, ahead of me, there was also I don't know if it's the same person that was at the one earlier this month, but yes, I mean, women of color, mothers, maternity needs. There's a huge space, and we need to make sure that we're reaching out and capturing all those segments. And what I love about HitLab, Riley, is that you've got these great events, but you can put in so many different topics and so many speakers because everybody gets 10 or 15 minutes. So it's like you can pull in a lot more people. You can be way more inclusive and more robust agenda that many more traditional conferences provide. So thank you for that.
Absolutely. Well, we certainly enjoy having you on, and I'm sure we'll see you in December, and I'm sure
Great.
we'll see you before then. But thank you again for your insights. It's always great to chat with you.